January marks Liver Cancer and Viral Hepatitis Prevention and Awareness Month in the Philippines. Let's discuss liver health with Dr. Arthur Jason Go, Chairman of the Outreach Committee of the Philippine Society.
Well, hepatitis is one because some of education-wise, the pediatrician should actually be there to educate mothers to vaccinate their children, as well as hepatitis B can also be is prevalent also for those patients who have sexual partners, and then it's also a risk factor for blood transmission through, for example, blood transmission through needle injection, to sharing of needles. So those things, when you have a population wherein they are not educated about the spread of hepatitis B through blood contamination and through sexual contact, it can actually lead to spread of hepatitis. That also could lead to liver cirrhosis and further on lead to liver cirrhosis or liver cancer.
Do you think, Doc, that the education for the sickness is done well enough here in the Philippines?
So we need more awareness on that. We need more. That's why the Philippine Society of Medical Oncology, as well as the DOH and other medical society, is promoting Liver Cancer Awareness Month, especially also for Hepatitis Month, which is January, to spread awareness and to share to everyone the risk factors of having the possibility of spreading hepatitis B, as well as prevention of liver cancer.
Okay, now we've discussed, of course, the awareness, but moving on to treatment and diagnosis, is the Philippines equipped for that as well? Or do we also need more?
Yes, we are equipped for treating liver cancer. So, liver cancer is different from other cancers, wherein in other cancers, it's stage 1 to 4, but for liver cancer, we call it an early. We have localized, the advanced, and the terminal part. So as we go further to the terminal part, sadly, it's grim in a sense that mortality is very high. But for early stages and then for localized and advanced stages, there are treatments available. Surgical, transplant, we have that here in the Philippines. And then now for advanced and for terminal stages, we have newer drug available, such as your targeted treatment. It comes in a tablet form, and then we also have immunotherapy available already for liver cancer.
What are some symptoms we can look out for, or maybe for prevention?
So Denise, the problem with liver cancer, early on, we don't have any symptoms. That's the sad part. It's not like breast cancers or for colon cancers. Liver cancer, there's no acute symptoms noted. The later part, the patient would have symptoms of like jaundice or yellowing of the skin or the eyes, and then pruritus or the itchiness of the skin, and then there's some bruises, bleeding. Those are and then the worst part is the patient would have ascites, which is it's like their abdomen is being enlarged with fluid inside. So that is because of the liver is failing. So those are the sad part. That's the later part signs of liver cancer.
It's kind of
liver dysfunction.
Now it's kind of terrifying to not be able to, of course, pinpoint this early on. So what are some ways that we can take care of our liver health, of course, without having it to reach that point?
Yes. So first of all, liver cancer is not just for hepatitis B. It can be and it is because the underlying cause is really a chronic inflammation that's happening to the liver. That is it can be because of, like, for example, obesity, fatty liver, and it's called non-alcoholic fatty liver diseases. And it can be because of diabetes, obesity. So those factors also are risk factors that can cause chronic inflammation to the liver. So if the patient has liver cirrhosis already, then we advise to do some screening every 6 months of an ultrasound with an expert ultrasound technician to do the ultrasound, and then plus or minus to do a blood test, which is called the alpha-fetoprotein. So that, in a way, can actually, if seen already, if there is a lesion or a nodule seen in the liver tissue, then we can actually detect that and we could immediately give treatment and hopefully caught it early rather than in the advanced stages.
Doc, when you were talking about the symptoms in the latter end, of course, a lot of it, of course, happens appearance-wise. How do you fight against the discrimination that could potentially happen?
Well, education-wise, you have to actually really explain very well to the patient the course of the course of the sickness, and as well, of course, the stigma of having hepatitis as well for other people. Hepatitis actually is treatable. Okay, the viral replication can be stopped. So when in the fear of that, if the patient or the family relatives is explained well, they are being explained properly, that they know that it can be controlled. So the spread of that infection can be halted and be cured.
Dr. Arthur Jason Go, Chairman of the Outreach Committee of the Philippine Society of Medical Oncology. Doc, thank you so much for joining us.
Thank you. Thank you. Good afternoon, everyone.